Hey everyone, excited to jump into a new deep dive today. We're tackling the world of aesthetic medicine. And let me tell you, it's a lot more than meets the eye. We're going behind the scenes to uncover what it really takes to start a successful practice. We've got insights from experienced practitioners who've been there, done that, and built thriving businesses from the ground up. Whether you're a medical professional or just curious about this booming industry, this one's for you. So first off, can we just talk about how much aesthetic medicine has blown up recently? I mean, it's everywhere. It seems like more and more people are ditching traditional dermatology and plastic surgery for these non-surgical options.
Yeah, it's been a pretty dramatic shift, and there are a few big reasons behind it.
What are some of the main things driving that, do you think?
Well, for one, people are busier than ever. Who has time for weeks of downtime after surgery?
Nobody. We want results and we want them fast.
Exactly, and that's where aesthetic medicine shines. These treatments are often quick, minimally invasive, and can give you noticeable results without going under the knife.
So it fits into our busy lives. Makes sense.
And then there's this huge shift towards preventative care these days. It's not just about fixing problems when they arise, it's about maintaining that youthful look for as long as possible.
It's like that saying, an ounce of prevention is worth a pound of cure. Applies to wrinkles too, I guess.
Absolutely. Why wait for wrinkles to become super deep when you can start addressing them early on?
And I've got to imagine social media plays a role too, right?
Oh, absolutely. With social media, people are constantly bombarded with images of these subtly enhanced faces. So naturally, there's a huge demand for treatments that can give you that overall rejuvenated look.
It's like a whole new standard of beauty. And it's interesting, even plastic surgeons are catching on to this trend. A lot of them are incorporating aesthetic medicine into their practices to stay competitive and attract a wider range of patients. It's true. I read somewhere that plastic surgeons were some of the earliest adopters of using Botox and fillers. They saw the writing on the wall.
Yeah, they realized it wasn't a threat to their work, but another tool in their arsenal.
Makes you wonder what the future holds. But one thing that stood out to me going through all this research was how accessible aesthetic medicine has become. It's a far cry from the old days where you'd have to travel hours just to get a Botox treatment. Now, it's practically like going to the salon.
Right, people want it all, and they want it conveniently located.
Exactly. So we've established that aesthetic medicine is booming, it's in demand, it's accessible, and it's only getting bigger. But if you're a medical professional looking to break into this world, where do you even begin? What's the most practical and profitable way to get started? Well, the experts we spoke to all seem to agree on a surprisingly simple starting point: Botox and fillers. Now, you might be wondering, why Botox and fillers? What makes them the foundation for a successful aesthetic practice?
Well, first off, think about the investment. You compare it to something like a laser. Those things can be crazy expensive.
Oh, tell me about it.
But Botox and fillers, they're a much smaller financial commitment up front.
So it's more attainable for someone who's just starting out. They don't need to take out a second mortgage just to buy equipment.
Exactly. And the great thing is, those treatments are in such high demand, they're relatively quick to perform too. So you can see more patients and really maximize your earning potential even early on.
Makes sense. It's
Yeah.
like you want to start with something that's going to get you a good return on your investment fairly quickly, right?
That's the idea. Although you'd be surprised how many practitioners kind of overlook the most important part of it all:
Which is,
mastering those basic injection skills.
it's not as simple as just sticking a needle in, huh?
Not at all. You can't just watch a couple of YouTube tutorials and call yourself an expert. It's like any skilled profession. You wouldn't want a surgeon operating on you if they only knew, like, half the procedure. It's the same with aesthetics. It demands precision, a good eye, steady hands. You have to build that solid foundation of injection techniques so you can treat your patients confidently, minimize any discomfort, and really deliver those natural-looking results everyone's after.
Right, because no one wants to look like they got work done.
Exactly. And the beauty of starting with Botox and fillers is, once you've nailed those basic skills, that's when you can really start expanding your repertoire.
So it's about walking before you can run. What kind of things can you branch out into once you've got that foundation?
Oh, the possibilities are almost endless. You can go from treating those fine lines and wrinkles to addressing volume loss, even lip enhancements, all sorts of things.
Wow, so it's a whole journey. But when you're thinking about expanding those skills, how do you approach that holistically? Like, do you just look at a patient and immediately think, okay, we need Botox here, filler there?
That's where it gets interesting. You can't just focus on wrinkles in isolation. You've got to consider the whole face.
Like, is the skin looking a bit dull? Are there age spots?
Exactly. Skin quality, volume loss, overall facial harmony. These are all interconnected. Someone might come in thinking they need fillers in their cheeks, but maybe addressing their skin laxity with something like microneedling could be the real key to getting that youthful look they want.
Huh. So it's kind of like a puzzle, isn't it? Each piece contributing to the bigger picture.
I like that. A puzzle. That's a great way to put it.
But speaking of treatments beyond injectables, what about the folks who aren't quite ready to take the plunge with needles? What else does the world of aesthetic medicine have to offer them?
Well, that's where we get into the whole world of skin rejuvenation. Think of it as like laying the groundwork for that healthy, youthful glow.
Okay, so beyond the Botox and fillers, what are we talking about here? Break it down for me.
So you've got a whole spectrum of options. On one end, we've got what we call cosmeceuticals.
Cosmeceuticals. That's a mouthful.
Right. Don't let the name throw you off, though. They're basically skincare products, but kicked up a notch. We're talking pharmaceutical-grade ingredients that can really make a difference.
Okay, so like stronger stuff than what I can just pick up at the drugstore.
Exactly. Think retinols, antioxidants, those kinds of things. But they're formulated to address specific skin concerns, not just a general, oh, this might be good for your skin.
So it's like the difference between, say, taking an over-the-counter pain reliever versus something your doctor prescribes.
Perfect analogy. They both might help, but that prescription is going to target your issue much more effectively.
I'm getting it.
Yeah.
So it's not just slapping on any old cream. You really need to know your stuff.
100%. You wouldn't treat high cholesterol with a simple face cream, would you? It's the same idea here. You got to understand the science behind these cosmeceuticals to recommend the right products for each patient.
So there's real expertise involved. It's not just about which brand is trendy on Instagram. But what about those more noticeable skin concerns? Anything in this skin rejuvenation toolbox for that?
Oh, for sure. As we move along that spectrum, we've got treatments like chemical peels.
Ah, chemical peels. Heard of those?
They can be amazing for things like uneven skin tone, acne scarring, even fine lines. And then there's microneedling. That's another great one, really versatile.
I've actually been hearing a lot about microneedling lately.
Yeah, it's super popular right now, and for good reason. It can address so many different issues, from wrinkles and pigmentation to even stretch marks.
It's pretty incredible what you can achieve these days without going under the knife, isn't it?
It really is. Technology has come a long way.
Okay, so let's say I'm convinced. I want in on this whole aesthetic medicine thing. I've got my Botox and filler skills down. I know my cosmeceuticals. I'm a microneedling master.
Yeah.
How do I actually turn all that into a thriving practice? Where do I even begin?
Well, the great news is you don't need a fancy clinic or a huge marketing budget to get started. A lot of really successful practitioners, they actually begin by leveraging their existing networks. Yeah, you can start small, maybe offer treatments from home initially. You might even be surprised to find that insurance covers some of these services.
Really? I had no idea. That's amazing.
It's true. And think about it. You probably already have friends, family members, colleagues who are curious about these treatments, people they trust, whose opinions they value. Those initial clients, they're your foundation.
It's like that saying, your network is your net worth. Except in this case, it's your launch pad for building a whole business.
Exactly. And then as your practice grows, as you get busier and busier, you can start looking at those more formal marketing strategies.
Yeah.
Building a social media presence, maybe eventually transitioning to a dedicated clinic space. It's all about taking those strategic steps as you evolve.
It's like that saying, you have to walk before you can run. Start small, build a solid foundation, and then the sky's the limit.
Exactly. It's a marathon, not a sprint.
This has been a fascinating deep dive. It's clear this field is about so much more than just erasing wrinkles. It's about helping people look and feel their absolute best. And it all starts with that solid foundation of knowledge, skill, and a bit of entrepreneurial spirit. Now, for everyone listening, here's something to ponder. With aesthetic medicine becoming more and more integrated into our lives, what will it mean for our perceptions of aging and beauty in the years to come? Until next time, keep diving deep.